Alzheimer's disease is the most common cause of dementia, affecting more than 55 million people worldwide, including about 6 to 7 million in the United States. For the pharmaceutical industry, this represents one of the biggest opportunities in medicine. The current Alzheimer's drug market is about $7 to $10 billion, but it could grow to tens of billions of dollars over the next decade. Understanding the pathophysiology of Alzheimer's disease is essential for identifying the emerging nodes for pharmacological intervention in the era of precision medicine. Let's have a look.
In Alzheimer's disease, the core functional abnormality is a progressive breakdown of synaptic communication within neuronal networks responsible for memory, cognition, and executive function. By the way, I am amyloid precursor protein, or APP. I live in the membrane of neurons, where I help support communication between brain cells and maintain healthy synapses. Most of the time, when enzymes trim me, the pieces actually help neurons grow and function, but if I'm cut by a different set of enzymes, I can produce amyloid beta fragments, small proteins that may accumulate into clumps and disrupt signaling in the brain. These clumps are called amyloid plaques. They clutter the spaces around synapses and disrupt transmission, but also cause a pathological increase in the flow of calcium ions into the cells. Now, these guys are called tau proteins. Their job is to keep a neuron's internal transport system running smoothly. Inside nerve cells, they stabilize tiny structural tracts called microtubules, which act like highways that carry nutrients, proteins, and energy to distant parts of the neuron. Normally, they are regulated by kinases that phosphorylate them and cause them to release microtubules to modulate the cytoskeleton as needed. When excess calcium enters the cell, kinases get aggressive and over-phosphorylate them. It causes them to form clumps called neurofibrillary tangles and ruin the cytoskeleton and destroy the neuron. Finally, immune cells like microglia and astrocytes come around to do the cleanup. They consume amyloid and neurofibrillary tangles and stimulate an immune response that damages the synapses around us, propagating neurodegeneration in Alzheimer's.